Welcome to a user guide to mouth care products. This video is aimed at adding to your mouth care knowledge. National guidelines and legislation recognise that all inpatients, adults, children and young people should have effective mouth care offered to them at least twice a day. This includes the correct products and tools to use. Let's look at toothbrushes. It's important that you identify that the correct toothbrushes are used. Any of the toothbrushes shown here can be used to clean teeth, oral mucosa, or to provide relief to dry or sore mouths. Ideally, we want toothbrushes to be rinsed clean, excess water gently shaken off, air dried, and kept in a clean place. If possible, ensure that adult toothbrushes have a cover to avoid cross-contamination. For those patients, especially those with limited mouth opening ability, please use a child's small head soft bristle toothbrush. If an adult or a child is unable to tolerate that, please use a 360-degree toothbrush.
Okay, so this is our fantastic Orrelief 360-degree toothbrush, which is a very unique brush. So the bristles are positioned at 360 degrees around the head there. It's effectively designed to clean teeth, so it can clean as much teeth as a standard manual toothbrush, but also it has been designed to clean soft tissues really effectively as well, and comfortably and safely. It has a long non-detachable handle, so for example, if you were using it to clean somebody else's teeth, which is often the case, you may be using it, for example, on a patient with dementia, they're not going to bite down on that head and detach it, so it's a really good alternative to some other options out there at the moment in the hospital setting. Also, if you're brushing somebody else's teeth with it, you've often not got very long to get in there, or much access actually to get in there to clean the teeth effectively. So because it has such a small head and the bristles are all the way around, you're going to remove more plaque in a shorter space of time than you would otherwise. It can be used to hydrate the mouth as well, because it does contain 20 times more bristles than your normal toothbrush. So we can use it to retain water and hydrate the mouth as well. We often get patients at end of life with dried on secretions in the mouth, and this brush is ideal for just removing those secretions really comfortably, safely and effectively as well. We can also use it to apply the dry mouth gels as well around the mouth, so we can just pop a pea-sized amount onto the brush head and use that to massage into the tissues. And we do have a children's version available as well, which many parents are finding really useful to clean children's teeth when we don't have, again, much time or much access as well.
Suction toothbrush. This can only be used once training has been given and is used for patients who are unconscious or have difficulty swallowing or are at risk of aspiration. Please note, foam sponges are not advised and are no longer available from e-procurement. Let's now look at toothpaste. Identifying the correct toothpaste is really important. If patients have their own, please use that. However, if they haven't, we can order normal Colgate toothpaste or standard toothpaste from procurement. For those patients that have a really dry mouth or are at risk of aspiration or have swallowing difficulties, have dementia, or patients who are nil by mouth, we can also use the Oraleve non-foaming toothpaste. Now let's watch the video regarding Oraleve mild toothpaste.
And this is our Oraleve Ultra Mild toothpaste, which contains as much fluoride in it as a standard toothpaste would, and the recommended government levels, which is 1450 parts per million. It's just very mildly minty, because we don't want to aggravate a dry mouth, but we do want to leave patients with that pleasant minty flavour that they expect. It doesn't contain a foaming ingredient called sodium lauryl sulfate. Now, this foaming ingredient, which is included in many dental products, can actually cause a dry mouth to worsen. So this product is free from SLS, and doesn't contain any alcohol either. So we can use it twice a day, and it complements the rest of our dry mouth range, and it deeply moisturises as well because it contains the enzyme system.
We also offer vegan-friendly alternatives, which is called Aura Nurse, and again, this can be ordered through procurement. Let's then think about patients who have a dry mouth and require lip care. Dry mouth care. There are many products available as oral sprays and gels with the purpose to relieve the symptoms of a dry mouth. They are not an alternative to toothbrushing with a fluoride toothpaste and mouth care. Dry mouth gels should be massaged into the soft tissue of the mouth, tongue, cheeks, and lips. And we're going to see this on the video shortly. Dry mouth can be caused from dehydration, medication, and oxygen therapy, to list a few. Firstly, advocate frequent sips of cold water. Please note that the dry mouth care products cannot be used for vegans or people with milk allergies. Let's watch how to apply and use the moisturising gel.
Hello everyone, I'm Jackie. I'm a dental hygienist and I'm also an oral health educator with Oraleave Dry Mouth Relief. I just want to give you a quick run through of one of our favourite products. So it's our Oraleave Dry Mouth Relief Gel, and just talk to you a little bit about how you can use it. So here is the gel. It's a really absolutely fantastic product, and it does give really long lasting relief in the mouth overnight, so giving you that uninterrupted night's sleep that you really want and deserve. So I'm going to be talking to you a little bit about how to apply that in the mouth as well. It's very neutral in flavour, so it's quite pleasant. It's not minty really or anything like that, so pleasant in flavour the feedback has been. It can be prescribed for you by your GP or your dentist, which makes it really cost effective. It does contain xylitol, which is a natural ingredient that helps fight tooth decay, of which with a dry mouth you are a little bit more prone to suffering from tooth decay, so that can only really help. And I would say that if you are a denture wearer as well, and you're having problems taking your dentures in and out, a squidge of this popped around the mouth, as I'm about to show you, can really help with keeping your dentures in, but also in inserting them and removing them as well. So I'm just going to show you a couple of ways in which we can apply the product. So we can apply it using our 360-degree toothbrush, which is also available from Oraleave, and this has really close, densely packed bristles in a 360-degree movement around the head there, and this is really kind to sort of sore sensitive mouths as well, so it's not going to feel uncomfortable when you pop the gel on. So I'm just going to pop some of the gel onto that. And with this one, really, you want to aim at massaging into the tissue. So the key is in massaging it in, really. We don't want it to sit as a sticky layer on the top. We really want it to penetrate sort of deep into the tissues, so that we get maximum benefit from it. So we can just use a slightly rotating method in order to just massage it in wherever. Into the cheeks and onto the roof of the mouth. Excellent, so it's a really effective way of popping the product on. If you prefer, you can actually just put a dab on your fingertip, don't need too much at all. And again, you're aiming to massage it into the tissues, and you want to try and do that for about 30 seconds to a minute, just to really let it soak in. And it's as if you're massaging in a face cream, really. So again, you want to use a circular movement to massage it into the cheeks and the roof of the mouth. And that can really help that sort of tongue sticking to the roof of your mouth sensation that you can get in the night, sometimes when you wake up in the morning. Just applying some of that to the roof of your mouth.
Let's now move on to lip care. Lip care is required for those patients that may have dry and cracked lips. Relief Nourishing Lip Care is advisable as it is water soluble and can be used for patients who are on oxygen therapy. Let's find out some more information.
So this is our Oraleave Nourishing Lip Care, which is perfect for anybody with dry lips. Often, if they've got a dry mouth, they will also suffer with dry lips as well, and that can be year round, not just sort of during the winter. It's also really good for angular colitis, which you can get sort of little cracks forming in the corners of the mouth, and it's really useful to pop on that. It's water-based, so it's really suitable to use for patients in hospital on oxygen as well, because we want something that's non-flammable and isn't going to pose an aspiration risk as well. So we just need a very thin layer on the lips. It's going to last a long time. It's also non-occlusive, so it allows the pores of the lips to breathe underneath, and really good for wearing all day when you're wearing a mask in surgery as well.
There will be some other products that you may need to order from procurement. These are denture pots. They need to be labelled with an addressograph label, and please note dentures should be stored clean and dry, not in water or denture tablets. You will also need a pen torch, which is essential for the mouth care assessment, and a surgical marker to write the name or patient's initials on their dentures. As you can see from the picture, it's important that you write the name or initials on the pink element of the dentures. The denture may need to be frequently remarked. However, this does not cause any taste or issues to the patient. A lost denture will have a massive impact on patients' ability to eat and drink, and also costs the NHS about £2,000 for replacements every time we lose people's dentures. There are also some non-stock items available, which are denture adhesive, finger guard for those patients that we need to keep their mouth open to help with toothbrushing, and potentially a three-headed toothbrush. These are required as a specialist order and can only be used following special advice. If you've got any concerns regarding the products, please contact procurement, who will be more than willing to help you. Thank you.